Good afternoon, Wisconsin. This is Robert Chappell, Executive Editor of Madison365 with your daily update for Tuesday, April 27th. Hope you're having a wonderful day. It is beautiful outside. So as soon as we're done here, I want you to get outdoors and enjoy yourself. And you can do so without a mask, according to the CDC, especially if you're vaccinated. The new masking guidelines basically say if you're vaccinated, you don't need a mask outdoors, right? Indoors, still a good idea. We'll talk about some numbers here in a minute, but this thing is not over. You can't just throw all caution to the wind. But once you're vaccinated, like being outdoors with a mask is just fine. So if you are vaccinated, get out and try it. If you're not, get out and try it anyway. Just mask up when you're near people. Cool. Need to mention our sponsor for today. The update today is brought to you by the Just Research Program, which is seeking Black adults age 40 and older, men and women, and any other genders, to participate in a 10-minute online survey. This is not a clinical trial. They're not testing any medicines on you. They're just asking questions about what would help you take part in a clinical trial of new medicines. The reason they're looking for this information is that most medications and treatments are tested on white people, even if the diseases they're trying to cure are more prevalent in Black people, right? Obviously, this doesn't work. I don't even need to explain it to you. So if you're willing to help out and give them 10 minutes to talk about what would help you decide to participate in a clinical trial, call this number, 608-709-9470, or shoot them an email at justresearch@ictr.wisc.edu. All right, so we'll talk through some numbers, and then I have an interview with Dr. Nestor Rodriguez, who is an emergency room doctor and in Watertown, and is also Latino, obviously, and also a COVID survivor. So I talked with him, and he's very frank about the experience of working through that in the emergency room, but also the challenges of getting, especially communities of color, vaccinated and why they have to do it. So let's talk through numbers first, then we'll have that, and then we'll talk about some other local news. Today, our cases are kind of high today, but it's a Tuesday, right? And again, we're virtually identical to last Tuesday, which I guess is good. 815 new cases today, 805 last Tuesday. So, we're going through sort of weekly patterns of 300 something cases on a Monday, 800 something on a Tuesday. That's to be expected. So I don't worry too much about that specific number. The number that I'm most concerned with is the positive test rate, right? The average average tests that turn back positive results. In the past 7 days, that's 3.1%. That is good. We'd like it to be below 3, as it was, mid-March. It was below 3, and it has been kind of going up, and now it's been coming back down. And it's been hovering for the last 5 days right above 3.0, like 3.1, 3.2. So that's fine. It's not great. I would prefer it to be lower. But the fact that it's kind of hovering right there above 3 is okay, right? We still need to, especially if you're not vaccinated, first of all, what are you doing? Go get vaccinated. Secondly, keep your mask on, keep your distance, all of that, to try to push that below 3. Now, one other number that concerns me a little bit today is we are reporting 17 fatalities. Now, we reported 13 last week, Thursday, and 19 on Friday. I'm sorry, that's wrong. 13 on Friday, 19 on Saturday. -1 on Sunday, 0 on Monday, and now 17 today. My initial thought with those higher numbers last week was that possibly these were catch-up data, that these are older fatalities from months ago that are just now getting confirmed. To see this again, another 17 today, I'm a little concerned that these are actually maybe more recent. Because, remember, fatalities are a lagging indicator, right? So if you have an increase in cases one day, you're going to have an increase in deaths 4 weeks later. Our increase in cases started about 4 weeks ago. That's when we started to see the 800, 900,000 cases again after a month of 200, 300 a day, right? Remember, March, we were low. And then as toward the end of March and into April, we started to go up. Now, 3 or 4 weeks later, we're starting to see the effects of that with 17 deaths today. I'm concerned that that's what it is. That maybe it isn't catch-up data. Maybe it is really. So we'll see in the next few days. We'll kind of confirm whether that's true or not. Cross your fingers that it's not, but we will see. Now, in terms of vaccinations, again, we've been slowing down partially through hesitancy and partially through complacency, that people are just kind of don't want to deal with it and are kind of finding excuses not to do it. We have, let's see, about 21,000 more people finished their vaccine in the past 24 hours, which is, it's a big number, but it's not enough, right? I'm just going to grab the daily average is now 41,295 for the 7-day average. That was 63,000 not too long ago, right? Yeah. As of the 11th of April, just a couple weeks ago, that was 63,000 a day. Now we're at 41,295. That's not going to get it done. Like that. I mean, it'll get it done eventually. But here's the thing: we're going to have enough vaccine supply to have 80% of us vaccinated, and therefore, achieve herd immunity in Wisconsin by the 4th of July. Right? But that vaccine doesn't do anything sitting in the fridge. Like, people have to go get it. Right now, we are at 31.9% have been fully vaccinated. So again, we'll get there. It's just a matter of how quickly. 42,000 a day and dropping isn't going to cut it. Okay, we have to get that back up to 50, 60,000 a day. We hope. We'll hope that works. All right, that's all the numbers and the stats that I have to talk about right now, as well as don't forget that mask mandate. If you're vaccinated, you no longer need a mask. Let me caveat that mask thing. It's not a mandate; it's guidelines. You can still wear a mask if you want to. And please be kind to people who are wearing masks, even if they don't need to. If you see a person wearing a mask outdoors, leave them alone. It's fine. They don't have to wear a mask outdoors, especially if you're vaccinated, but just leave them alone if people want to. It's fine. All right. This is my conversation with Dr. Nestor Rodriguez. After this, we'll take a short break, and I'll have a couple of the local news items for you, including a very exciting theater festival coming up. So don't go away. Here is Dr. Nestor Rodriguez. And joining the program today, Dr. Nestor Rodriguez. Thank you for being with us. Dr. Rodriguez is the founder and CEO of Carbon World Health and the medical director of emergency services at Watertown Regional Medical Center. Thank you so much for being with us today.
Thanks for having me. It's a pleasure to be here today.
Good. So can you talk a little bit about your experience, in the emergency services over this past year? And we've heard a lot of stories from all over across the country. Can you tell us just a little bit about what you saw?
So yeah, it's been an interesting year, I would say. For me, coming from a perspective where a hospital was in between two counties that were hotspots, we were kind of pushed to the limit. I remember when it first started coming out, we weren't ready, right? And that's the thing with the pandemics, where we had to come together as a group and treat people. The biggest kind of frustrations for us were all the information and how it was coming out. And I think to this day, it's been this kind of misconception that all hospitals or all places and facilities are created equal, so to speak. And what was being said in terms of what was not necessarily the reality in given hospitals. And so for us, for example, we started with the pandemic where we were kind of short-staffed, both on the physician and nursing side. And so when we're attempting to kind of rev up staff to try to help out, obviously everyone else needs help too. So there was a shortage in terms of people coming in. So that kind of led to a lot of us taking extra hours, taking extra shifts, things that normally, we wouldn't necessarily do, but we knew we had to do for the community and to step up. And at the same time, it was just imagine knowing how to do this. This is bread and butter emergency medicine. But now this pandemic hits where we don't know what medications work, what treatments work. We're getting what the media says should or shouldn't work. Patients are, I talked to so-and-so, it's not a big deal. Other patients I suffered someone that's dying. And so, it wasn't just treating the patient, it was all the other social things around it. And subsequently, when the hospital put policies of no visitors, everyone has to wear masks, all these things that, us as frontline workers, so to speak, it was kind of told to us and we had to do. But we kind of the brunt of everyone being upset of what's going on. Meantime, we're just trying to help. And so it was tough. The medical part, I would say is the medical part we love, and I love being there, and all my staff loves being there. I think the emotional and the psychological part of the pandemic is what got a lot of people in terms of not being to use all our treatments, not even being able to use all our, for example, like intubation at first was, do we do it, do we don't? Nebulized treatments, do we do it, do we don't? And, it almost felt like we went 10 years backwards in medicine for a short period of time when we were trying to treat people. So that, I think that was the tough part for us, I would say, at a local hospital where, we're not the academic center. We don't have all the resources. We're not the first ones to get the test. We're not the first ones to get the vaccine, things like that.
So you were kind of learning on the go. You have this brand new thing you got to figure out right now, right?
Correct. Yeah, no, it was. We basically, we knew it was there. We knew that despite what people thought, it exists, right? The people would try to argue with me, I would leave the hospital, it doesn't exist, or hey, my brother got it and it's not a big deal. To the point where I would argue with people and they'd say, hey, well, the numbers are lying. No one's died in my family. I'm like, yep, we're seeing it. Trust me, I'm not spending every day trying to make this stuff up or trying to finesse the numbers. We were so busy that we couldn't even think of that.
So how are things right now? I mean, we see statewide, the statistics show that things are better than they were, a year ago, better than they were last fall. How is it feeling right now, day to day?
So luckily for us, I mean, I think in the state and particularly in our hospital too, the numbers are significantly down. We still see it, so we still have to keep our attention to it, and we still have protocols to go in. But the numbers are down now. What we're seeing is, unfortunately, we told people stay away from the emergency departments unless you're really sick, and people were scared about when should I go, when should I not go. A lot of appointments for primary care were canceled, surgeries. So now we're seeing an increase in volume, but of kind of chronic diseases, things that normally would have good checkups, good follow-ups, that kind of fell through the cracks, or just because they were pushed out more, people were scared and they tolerated more. So we're seeing that increase in volumes, which are keeping our hospitals busy now.
Right. I get it. So let's pivot a little bit and talk about vaccinations, because we're seeing a lot of people get either their one Johnson & Johnson shot or their 2 Pfizer Moderna shots. We're at now 42,000 a day statewide doses being given. Are you seeing people in your neck of the woods willing to get vaccinated? And if so, or if not, what are the barriers that you see?
So we are. So luckily for us, one of the things that when it first came out was, at least in the hospital setting, was it going to be mandated or not? I think we anticipated this kind of 2 cycles of immunizations, one being the people that wanted to get it, whether they thought they were high risk or whether we recommended they were going to go straight on our recommendation as doctors. And then I think now we're seeing that, well, I wasn't too confident. Let me see what happens. And now I want to get on the train, so to speak. And that's assuming if you had it, right? But for us, luckily, we are seeing our hospital's doing a great job at pushing immunization. I think us as a state, at first, it was, I would say, we had some challenges in terms of how we're going to distribute this. But now it is, and it's becoming available for people to take. For me, one of the things when you talk about the obstacles to get it, there's several, and I think those are the biggest things to talk about when I talk to people as to why. One, I think just from the disease itself, depending on people's experience, they say, well, it's not that bad, so I'd rather get COVID than this vaccine that I don't know what's going to cause me, right? I personally got COVID. I was extremely sick for it to the point where I should have probably been hospitalized, but I didn't. I wrote it out at home, but I also had tons of medical people around me that could come to my house, which is not the norm, right, for people. Right. And so what I tell people in terms of that is, well, we don't know also about COVID. We don't know long-term effects. And so it's kind of one of those, well, we don't know long-term effects of the vaccine. Yes, but it's been studied and it's been looked at differently than just this disease process that we're just learning as we go. So sometimes people say that, and I kind of rebut them with saying like, yeah, but we don't know long-term, because you had COVID, you're going to get something, right? On the flip side, the other thing is in terms of you see on social media, I got it and I feel like bad. I felt horrible, right? And I always tell people, particularly in our staff, when I tell people when you post on social media, use that relative, because there's so many cases of like, let's say you drank too much. How many times have you posted, I feel so bad, I'm never gonna do it. So it's all relative. So like how bad is that, right? So the people that have had COVID and get the immunization, they do tend to get more of a response, but that makes sense because the vaccine, it's all trying to develop antibodies in your body. So it recognizes the virus when you get it. So when I got it, it did affect me longer. It was for 24 or 48 hours with symptoms as if I had COVID. Well, I had family members and colleagues that it didn't affect them other than the arm hurt, but now they have this immunity that's there. Mm-hmm. I think the other thing that was a challenge, and still a challenge, and I like that the youth is kind of using their skill set on the computer to do it. And every day you hear, high schoolers, grade schoolers, like pretty young people being computer savvy and helping the elderly or the disenfranchised, so to speak, because it is hard. Here where I have connections or I have access to where things are, it was easy to get people vaccinated. They ask me questions. My mom's in California. She's not, you talk about us doing this video conference. She's like, I don't know how to do that or how that even works. Yeah. And so for her, it was, every day trying to click through this computer to try to get her vaccinated. That's a challenge for a lot of people, whether you have access to computers, whether you have access to internet. And then just having to redo it, right? Because people will get frustrated and pretty much kind of give up on the process, I would say. So I think that's been a big challenge. And then it's just the concerns, right? Especially now with this Johnson & Johnson of what is it? Am I still going to get it? And I always remind people, any of these immunizations and vaccines, you talk about tetanus, all these things that we look in general, I mean, they're studied pretty well. And it's not necessarily to say that you're not going to get it, but it's also that if you do get it, you're not going to proceed to being worse or to being like the extreme symptoms on that. Because people forget, and I hear the emergency room all the time, particularly with flu, right? Now with COVID, it's like, oh, I got flu the one time I got the vaccine. Well, did you, or was it just a response because your body's building immunity? Or if you did, would you have been worse off if you didn't, right? And that's different for everyone, because nowadays, back in the day, I think in medicine, you would picture a certain person and a certain type of person or body size, and you would say, hey, they're sick or not sick. Nowadays, it's all over the place. You can't just look at someone and say, hey, they live healthy or they don't, because so many different things go into it. And so it's all kind of relative, and we kind of just bunch people in general for that. I think with the Johnson & Johnson, it was people always confuse 90% versus 68%. Which one's better? What should I need to do? And again, that's the big thing of saying, no, this is if you get it, you're not going to get worse. And it's also going to help you not get it. But that's not 100% that you're not going to get it for it.
But your advice pretty clearly here is whichever, get the vaccine, whichever one you can get.
Yeah, I do. I think it is. And one of the things, and basically Madison365, but I'll say it here, and when I tell people and in talking to people, of ethnic backgrounds, being Latino, when I talk to my population, both here but in South Central LA where I grew up, a lot of times we do feel disenfranchised in terms of like we don't get the care that others get or Caucasian counterparts do. And in this vaccine, this is an opportunity now where, especially with the times, if there is those opportunities to get it, not to let our kind of inner fears, because I get it. That's what took me to emergency medicine, to try to alleviate some of those fears I had growing up. But in being that it has been studied not only in the Caucasian groups, but it's been studied in different. So I do think it's safe, and I do think this is one thing where we can be proactive about getting it, because unfortunately, just by genetics and certain lifestyles or access to care, sometimes we are at higher risk than other populations. Yeah. So I think for us, more so, being, you could say, selfish, so to speak, is like, yeah, I get it. If you have access to it, this is the time to do it. And kind of, I know those fears exist, but I'd be the first one. I had my 98-year-old grandmother get it, and it's be the first one to do that. And you always have to put it in reason, right? I know with the Johnson & Johnson, if we look at it, it does in certain people can cause blood clots, and you always have to be smart about which one you get, and talking to your doctors why to get one versus the other based on your medical advice. Oftentimes we just hear this blanket statement of getting them, but like, you talk to your doctors, have access to it, learn about it, but make sure you get it, and don't let that fear kind of prevent you from getting it, because again, this is one thing where you can have control of your own health. And I jokingly always say to people that argue with me, no, I don't want to get it. I'm like, I think if you want to travel ever in the next 5-10 years, I think get that for that reason too. You're going to get it for the right reasons, but hey, you're also going to get to travel.
Cool. All right, Dr. Nestor Rodriguez, I really appreciate you giving us a few minutes today.
No problem.
And we appreciate Nestor giving us the time. He's always willing to help us out on our summits, and if we need any, if you need to talk to a doctor, he's the guy we call. All right, we're going to take a short pause, and we'll come back. We'll have lots of local news and national news for you right after this. Stay with us.
Here in the Midwest, community is important.
Having a healthcare system that's looking out for us,
that's actively addressing the racial disparities in healthcare, is important.
When we can get good quality care, we can do more. We can achieve more.
We can be the kind of community we want to be, and that's really important.
UW Health. Remarkable medicine. Remarkable care.
All right. Once again, I want to remind you of a thing we have coming up on Thursday, 2:30 p.m. right here on Facebook Live. You'll see these 5 gentlemen. These are the 5 police chiefs and sheriffs from Wisconsin who are Black. Calvin Barrett, Sean Barnes, Jeffrey Norman, Ernell Lucas, and Andre Sales. We're going to ask them some potentially difficult questions. We're not out to get them, but we're not out to go easy on them either, about the current state of affairs and what's happening across the country in relationships between police and communities. Oops. Also, today on the site, I have a story on this. This is the first time ever that the Madison Metro School District has an all-Black leadership team. So last night at the school board meeting, Ali Muldrow was elected president of the school board. Savion Castro in the center there is now the vice president, alongside now Dr. Carlton Jenkins, who is the school superintendent, who took that position in August. So they had some really insightful things to say about what this means and what the moment is, and how they plan to tackle some of these sort of historical inequities and disparities in the school district. So that is on Madison365.org right now, and it was very nice of them. The meeting went, as school board meetings often do, went to like 9:30 at night, so they were good enough to talk to me for a few minutes after their meeting very late last night. And finally today, the Loud and Unchained Black Theater Festival is on. Now, this is something we reported on a year and a half ago, probably January 2020, I think. We initially reported when they announced that this Black Theater Festival is going to happen in June of last year. It was going to be the first ever, only like the 6th ever in the United States of a Black Theater Festival. And this local group, Loud and Unchained, was going to do it. And it got so much excitement. And that story, when we put it up, just went absolutely viral. Like, everybody was so excited about it. And it was just really hard when they had to cancel it. But they didn't give up. They kept going, and it's going to happen this week. It's going to be virtual, and it's going to be free. So there's a bunch of shows, a bunch of plays, a bunch of stage readings of plays, real Black theater happening right now, including a play by a Madison native who just won the Yale Drama Prize. So go to Madison365.org right now. Take a look at that story that Dave Dahmer did previewing this. It's happening this upcoming week. It's free. It's online. I will not be missing this, and I don't think you should either. All right, that's all I have for you today. I will acknowledge one national story that we're continuing to follow, and that is out of Elizabeth City, North Carolina, where Andrew Brown Jr. was shot and killed last week, Wednesday. We are kind of all just waiting for body cam footage to be released. It has been a portion of that body cam footage, about a 20-second clip, has been shown to his family, and they have said it looks to them like an execution. So we will be keeping track of that. The city is under a state of emergency, anticipating protests as soon as that body camera footage is released. So when it is released, we will have that for you. I just don't have any new information for you today on that, but I wanted to let you know that I am following that story as well. All right. As I said, it's a beautiful evening. I'm going to go fire up the grill. I hope you can too. I hope you have a wonderful evening, and we'll have the It's Only 10 Minutes podcast tomorrow morning. We'll have more news for you all day tomorrow, and then I'll be back tomorrow, 4 o'clock right here. Have a wonderful evening, and we'll see you soon.
This is 365 Media.